there are many things that I've been learning in the last years and the knowledge that I've been absorbing that in my lifetime, I wouldn't have ever believed that I would be able to absorb. Things of how do you vibe code? How do you generate images and videos? And how do you generate documents and create websites, in a matter of days? I believe that there's so much to learn right now that doctors should more think about, not about the things that they don't need to do, but more about all the amounts of things that they actually need to do right now to be able to get ready for the next couple of years.
So this is the Visible Voices podcast, and I'm Dr. Resa E. Lewis, emergency medicine and lifestyle medicine physician, medical educator, designer, and your host. I'm here with Dr. Jonathan Bringas Dimitriadis. He's the CEO and co-founder of Lapsi Health. He's also proof that the people who change medicine are often within medicine and seek to redesign how to do things more efficiently in a patient-centered and physician-centered way. He left Peru to study medicine in Cuba. He then recertified as a physician in the Netherlands in Dutch. He and his co-founder, Dr. Diana Van Stein, built Keiku, the world's first FDA-cleared digital stethoscope with an AI-integrated scribe. It listens, it scribes, it helps clinicians detect heart murmurs with 90% accuracy. And it does all this in real time, at the bedside, at the point of care. Jonathan, welcome to the Visible Voices podcast.
Thank you so much, Resa. It's an honor, and I've heard so much about your podcast. And you said my name very well, which is unheard of.
In another life, I would be a polyglot who speaks about 12 languages. A language that you and I share is medicine, medical education, and healthcare design. I actually believe all of us are designers, but a lot of physicians don't recognize that they are. But we are most able, because we've worked inside the clinical environment, to give thoughts and feedback about the built environment, about workflows, protocols, but about devices. Tell us about the origin story of Lapsi Health.
So Lapsi was basically born in a car. It was myself and Diana. We were driving back home from the hospital where she had had a shift. And she had a patient that had some complications with asthma. It was because, unfortunately, the physician that had seen the patient on that day or earlier even hadn't really noticed the respiratory sounds that are pathognomonic for asthma or for an asthma exacerbation. And Diana was, this is inconceivable with the current technologies that we have nowadays. We should be able to detect these things. We should be able to also detect them, at home. We should be able to detect them from voice, from breathing, from sleeping. Like, why are we not focusing in such important topics, such as pediatric asthma, for instance, which is one of the biggest topics in pediatrics and that has never been resolved. And it's even more and more increasing nowadays. I feel that the field is calling for a company that could potentially do something like this. And then when we started to explore, medical microphones, but also ambient microphones, we realized that the opportunity was way bigger than just physiologic sound, that we could potentially really create a platform that spans multiple technologies and AI opportunities using the power of microphones.
So she finished her shift. You two were talking sort of the post-shift debrief that all of us need. And there was a problem. And often no one is coming to save us. Trying to answer and seeking to answer those problems, those questions, becomes the birth of innovation such as Lapsi Health. And you've taken it a step further. You have a device. My lens has been point-of-care ultrasound. Handheld as well as cart-based machines at the bedside at the point of care. You have a device, Keiku, and that is also point-of-care, integrating AI in very interesting ways.
For us, when we thought about a stethoscope, we said, well, yeah, the stethoscope is the beginning of our journey. I think that many physicians understand the role of a stethoscope in a day-to-day healthcare and the practice of medicine. We have it on our necks all the time, even if we don't use it. And I think that what happens with the stethoscope is that in the space where we have been looking at medicine, general practitioners, pediatricians, actually it has a very important role nowadays still. And it has even a bigger role when it's in community healthcare and when it is in family health. So we said we cannot take a tool away from medicine that is so important, but we can build around it. And the first thing we said is, okay, well, there's definitely an advancement of microphones and microphone technology happening right now. The MEMS microphones have increased its potential, its sensitivity, the potential for frequency response, the signal to noise ratio potential of MEMS microphones in 2026 is a lot better than it was years ago. This allows us to be able to have more clarity, better data. This allows us to be able to run machine learning algorithms to be able to, deliver algorithms for diagnostic opportunities. And then when we were building on it, we started to think about ambient microphones. I think that was early on. We were at the beginning, the first iteration for ambient microphones for us was noise cancellation. And then after that, we were like, there's more than that. There's more than noise cancellation. There's voice. And we were always thinking about voice. And then suddenly the scribe revolution happened and everyone was scribing. And we were like, well, this could also be used for scribing. And we had perfected an ambient microphone array that had the potential to really acquire intricacies of voice better than microphones from phones or computers. So we said, this is even better because doctors don't have to use their personal phones. They don't have to use their desktops. The AI has less risk of hallucination because the data is higher quality and it is already embedded in your stethoscope. It's like a win-win. Yeah. So we said this is the first, usage of the ambient microphones. We will come after that I can't really say yet because, we're still in the process, but what will come after that is the usage of voice for more opportunities, both from the physician side and also from the patient side.
I want to go deep into and granular the actual device. Do you have one nearby?
I do, but we have to pause for a second.
Yeah. Good.
Okay, I'll go get it. All right, I got it here. Okay.
So exciting. I want to go granular into the actual device. And so for those watching on YouTube, can you show it to us?
Yes. So here's the Keiku. So what we say is it listens to your patient on one side, and then it documents your interaction on the other side.
So beautiful. And so handheld and light. And a few questions. When I was doing my background video watching, reading, I saw pictures with people with clothing on. Is the device better, worse? Does it matter if people are clothed versus the device touches the bare skin?
We have been testing on both with or without clothing, and we don't see a difference in frequency response. So scientifically, if you see it with the rigor of science, there shouldn't be any difference in how you perceive sound when there's no difference in frequency response of the microphones. That's for many, many reasons. So we have rubber system that damps the noise of the positioning noise and also noise of clothing. Also, there is a noise suppression algorithm that takes away some extra noise. And then the microphones, the MEMS microphones are really powerful. So they are not the typical pneumatic, bell, which only collects sound towards your ears through a tube. There's no real digital microphone there. And therefore you are supposed to, apply pressure, change the diameter of the audio chamber to enhance some sounds. That's why you just switch between bell and diaphragm and, your stethoscope. But that doesn't need to happen with digital microphones.
Again, my lens is ultrasound and probes, transducers that are touching the skin. There's been so much discussion over time regarding disinfection. And so whether it's using the purple wipes, the orange wipes, the gray wipes, soap and water, does it need to go and get actually sent upstairs to like central processing and cleaning? Where are you right now with disinfection? How does one clean the device?
You just use a wet wipe on the device. The device is closed and sealed completely. So there's no place of accumulation for bacteria or viruses in the device itself. We don't recommend to use any alcohol or detergents because it could damage the device. It is made of plastics that they are resistant, but they are not, how do you say that? Stainless steel. So you would have to be a little bit more gentle than with some other devices because they don't touch the skin and you also don't not necessarily use them in high risk situations. Just a wet wipe would be more than enough to be able to keep it clean. I also have seen that some doctors in South America, they are very thorough with their stethoscope, but what happens is that you can also accumulate some microdrops inside of the stethoscope, which is not great. So that's also something that they have to be worried about, that don't do it so often. And then I've also seen that the covers of the stethoscopes, they usually get damaged and they have to be replaced, which is
Yeah.
not ideal either for a stethoscope. But it's ideal that you keep it also away from like throwing it in a glass of water or anything like that. Don't wash it like that.
As you're expanding to the US market, like infection control is super serious, as I know you know, because you're exploring all sorts of markets. And literally, this evolution of the ultrasound probe has changed over time in terms of what's acceptable, what's not, whether or not we have to put a plastic covering and things like this. So, yeah, I'm really interested to see how things progress and sort of what where it all lands. It's super exciting that this is sort of a one-stop shopping device for all populations. As we know, the joke is always, oh, children aren't mini adults. So there are pediatric stethoscopes, with smaller bells. So how does the technology account for size, chest wall differences? And even actually at the other end, I'll just say people with a lot of adipose tissue.
100%. I would say I didn't really know how compatible it would be with neonatology before we launched it, because it is not a neonatology or pediatric stethoscope. And I was wondering about that, but I've seen doctors using it and they said that there's no problem with it, and that they like it because they don't have to be, they say, I don't really auscultate a baby to listen to every single valve independently. Right. So usually when you listen to a murmur in a baby, they are heard in every single valve because the heart is so small. So there's no point for me to just divide auscultatory points. I just want to listen. And the quality and the clarity is great. So
Yeah.
for me, this is good. And the same thing goes with pediatricians, both in cardiac and respiratory, and mostly in respiratory. The sound is very crisp for the lungs. We have taken a different route in terms of like sound processing, and we enhance our sound processing at the higher frequencies. So the heart sounds like a okay heart from like any type of stethoscope, but the lungs sound like there's like the sea and the waves, right? Because we believe that in terms of heart auscultation, there's a lot that you can do to detect valvular pathology or structural disease. But when it comes to the lungs, the majority of the diagnoses happen on lung sound.
Mm-hmm.
So, then we should focus on long sound, and we should focus on, crackles and that sound like crackles, and wheeze that is really perceptible.
It's the emphasis is always auscultating the heart. I would say a little bit more than the lungs. And this is like a full circle moment back to the origin story of Lapsi Health with your wife's pediatric patient and the asthma that wasn't completely appreciated. Ultrasound. Where are you with partnering with imaging and this device?
The reality is that the transducers of ultrasounds are too big right now, and the PCB, so the printed circuit board and the technology that needs to be in a handheld ultrasound is too big to compact it into a small device at the moment.
Yeah.
Yes, someday it might change. We are definitely looking at other sensors to bring into the device. We have a patent, so I guess you can guess which sensors we're going to add by just basically reviewing our patents. Yes, yes. So I guess I can tell you, we've been looking into PPG sensors.
And for audience members that may not know the lingo.
So that's photoplatismography. Those are basically light photonic sensors that have an emitter of light and a camera or micro camera that captures that light.
Similar to what we might see with a pulse oximeter?
Yes, similar to
Got it.
what we can see with the pulse oximeter or with the Aura Ring or with the Apple Watch.
In terms of language and language interpretation and AI scribes, where is the technology? We started by talking about speaking more than one language with language translation abilities or people with limited English proficiency. English is very much the language of medicine. Like, no matter where you are in the world, you can often discuss medical stuff. How are you rectifying the language translation?
So I think that is a really good question. I think you nailed it so much that if I respond to your question, I'm going to tell you what we're going to be doing.
No problem.
But also, I have to say that the opportunities for voice are so big as long as you have a really good acquisition solution. And this is the whole point for Lapsi. So we built this device. This device has a really great ambient solution inside, and it can already acquire the sound at a high quality. It has a multilingual scribe solution that already can basically acquire Spanish or Dutch or English or any language that you want. And then what comes next for us is a device that could potentially be able to learn or understand multiple languages being spoken at the same time, right? Which is something that we're really looking into. So I'm really liking it that you said it, because it's really something that we are actually working on. The other thing is, what can you do with voice? In 2026, with voice, you can do much more than just scribing. So, but to be able to do things well, I mean, I'm wearing a DJI to be able to be, in this platform, because otherwise, if I'm wearing any other type of microphone, it might not come crisp. Maybe people won't understand what I'm saying. And the same thing goes with technology for voice, right? So you can have an amazing microphone, or you can have a terrible microphone. It's like when you pick a car and then you're driving on Bluetooth and then it sounds horrible on the other end. What we wanted to do with Keiku was to be able to build this microphone array so powerful that can listen to the slightest changes in voice, so that at some point we can start to deploy some more diagnostic opportunities with voice.
Some of the original scribe systems in the emergency department, they didn't understand women's voices as well as men's voices. And I work with some startup developers that are looking at working with patients with limited English proficiency. And they learned part of their iterative process, elderly patients, because as people age, their voice changes, their vocal cords change, phonation, actually forming words changes. So they found that their tool wasn't actually picking everything up as well in someone elderly versus someone middle-aged.
And I can tell you even more. There are some very cool algorithms that can analyze that voice and those changes and screen diseases. So that's one of the roads that we're definitely going to be taking.
I was reading in some of the applications and some of the descriptors about even use in the abdomen. Where are you right now with exploring use of Keiku for the abdomen?
Not yet there, because we have a very long roadmap in terms of R&D, and also like we want to launched it in October, and we soft launched it. Now we are going to be launching our 3 definitive tools, hopefully by next month, and start going in the market in terms of enterprise and clinics. We're doing a pilot at a very esteemed hospital already. And what's the pathway towards abdomen? We obviously have to conquer so much before that. There is things that we have to do with lung sounds, things that we have to do with cardiac sounds, things that we have to do with voice, maybe adding other sensors. So it is an iterative process. I can tell you, it would sound a little bit like Elon Musk promising the Roadster, right? And then delaying the Roadster each time, like every year. We filed a couple of patents when we were able to prove our point in terms of sound in the abdomen and what things can be done there. But it is very early for us in the journey to be able to deploy it also, because abdominal auscultation is not that prominent. It would have to be adopted. And it's a different ballgame when you want to bring something that is not being done. Okay, now you have to do it. I think that meets a little bit bigger friction.
I'm laughing to myself because it's almost as if I was an audience plant asking you about language and language translation without really knowing. You just now were an audience plant without even knowing it, because you mentioned about an esteemed clinical trial. And I was wondering if you could speak about the science and what's happening and maybe data you have so far in the trial that's going on in Peru.
We've been basically looking into the efficacy of Keiku versus the usage of traditional stethoscopes, specifically at a pediatric cardiology department. And we did it with a really fantastic group of physicians. Involved are the former Minister of Health of Peru, the former president of the Latin American Society of Pulmonology. So these are like amazing physicians, and I'm very honored to be able to work with them. So far, what we've seen is really great results. This was a great adoption by the physicians, and I love that. It wasn't so difficult as we imagined in terms of using wireless earphones, because we were thinking, okay, but they love to hang something on their necks. Like, is it going to be the same? They do want
culture change.
Yeah, culture change. They did say, like, I need to wear it. Like, we would love to wear it. So we built this, which is a tiny little clip that basically you can just like clip it into it.
Amazing.
And then you can wear it as if it was, a pager.
Yeah.
So we said, well, at least you can wear it, right? They loved it.
No, I mean, see someone putting it on their collar, on their pocket if they're wearing a coat, and on their belt, like a bat belt.
Exactly.
Yeah, it's so good. So good. So at the top of our recording, you mentioned voice and bringing voice. We're recording on the Visible Voices podcast. When did you realize you had a voice, and when did you start using your voice?
Yeah, so I think that in coming from Latin America, it is not really in us to believe that we have a voice. Although we can be loud for sure. We in the educational system in Latin America does not make us believe that we can do the same thing as people from other countries and other regions, which is a fallacy because there's a great potential in everyone wherever they are, and there are great institutions in Latin America. How I learned that I had a voice was because I got inspired by a person that early on in my career, I was 14 years old. I was in my high school and I met a Nobel Prize. And this Nobel Prize, he decided to mentor me when I was a kid. One of the things that he taught me, and one of the best lessons that I learned, was that he had received so many no's in his life. He discovered that gene splicing and the mechanism of gene splicing and the introns and the extrons in the DNA. And when he had this theory, everyone told him that it was not conceivable and that he was wrong. And he said to me something that I will never forget. He said, whenever somebody tells you that you're wrong, and whenever somebody tells you not to do something, that is the motivation for you to do it. And I realized early on that this is what I have to do. I have to try to just, go with not in the conventional route and just find myself and my true potential, on my own. And if people like it, great. And if people don't like it, then I'll just continue. And there's going to be someone that likes it. It has served me great through my life. I was able to, find very great positions here in the Netherlands when I was working for multiple medical companies. Some people were wondering, like, this guy that is from Latin America that has been living here such little amount of time, and he's already a chief medical officer at a big medical tech company. How is that possible? And I think it was because of that voice, right? That was sparked in me by a person that really had a very powerful voice. And then I surround myself with people with beautiful voices and amazing voices, like my wife, like Diana. She has also an incredible voice, and she's also been practicing it since she was very little, in the highest podiums in Europe and in the world.
Circling back to AI in healthcare, one of the things that's brought up is deskilling and how it's going to affect physicians, doctors, in terms of, for example, the physical examination, the ability to use a stethoscope and auscultate. How do you balance that tension of progress, better healthcare design, and deskilling?
It's a very interesting question. Many people ask me, but a stethoscope with AI, why do I need that? Like, doctors should be able to listen, and with our ears, we can diagnose. And then when we say, well, we're gonna build more solutions around that and more sensors, and they're gonna also tell you this, and that, so you don't really need to. I think that that really brings a lot of friction. But I feel that it has always been like that in the world when new technologies come in, right? Before it was a calculator. Nobody wanted people to use a calculator at school. Like, no, that's a sin, right? And but now everyone uses a calculator. So I believe that this is just a matter of time. We need to learn to de-skill, but we also need to learn to skill ourselves in other things, or reskill, if you want to call it. There are many things that I've been learning in the last years, and the knowledge that I've been absorbing, that in my lifetime I wouldn't have ever believed that I would be able to absorb. Things of how do you vibe code? How do you generate images and videos? And how do you generate documents and to create websites, in a matter of days? I believe that there's so much to learn right now, that doctors should more think about, not about the things that they don't need to do, but more about all the amounts of things that they actually need to do right now to be able to get ready for the next couple of years.
So good. Game on, game on. So, speaking of learning and things to do, I'd love to round out our conversation and lead out with 3 micro skills, 3 actions or behaviors audience members can take if they actually do want to engage more with AI in devices, and even with Keiku.
There's a couple of skills that I really love. One of them is that I would recommend everyone to do. Nowadays, I'm using a lot of Claude Tropic, and there's a feature that not a lot of people are using, which is called projects. And I'm a big fan of projects, and I would recommend it to everyone to use it. So basically, you go on projects, you can build out a project, you can give this chatbot all the intelligence that you want. You can filing PDFs, images, information, links to crawl, loads of different pieces of information. And then you can basically build whatever you want based on that knowledge by giving it like very serious prompts. At the beginning, you might think, yeah, but I do that in my chats. But then you realize that when you have a central intelligence and knowledge base, and then you can redirect multiple conversations around those topics, you can create sort of like an intelligence for specific tasks. So I have a marketing one, which I love. It's a marketing project where that project has all the knowledge of Keiku and our website and the decks and the presentations and everything. And then every time I have an idea, like, would Keiku be good if I did this? I just go and I write down my prompt, and it already is completely contextualized with everything. So it is such an amazing tool. I would really recommend it.
That's number one. I love it.
The second thing is about Keiku specifically. I would say that there are pros and cons to using any new technology, right? There is an adoption, curve that we all have to go through. Even I, that I'm a founder in tech, when I buy something, I usually don't read the instructions, and then I get lost in in the journey, and then I have to call customer service. But the point here is that yes, there's a learning curve with Keiku. On the other hand, there's so many things that you can do with this technology. Now, when it comes to scribing, documenting, like right now, the Keiku is shining, and we are documenting a meeting note. So right now, it is like a cloud, right? It's not only for scribing. You can also just document your meetings, and it is such a fantastic tool. If you just give it like a little bit of adoption curve, you're gonna see all the amount of things that you can do with it and how easy your life can be. Finally, I would say that to review a little on the newest usages of microphones, because there is so much that is happening in audio that is completely overshadowed by generative AI that people don't know. If you look, for instance, into this company called Nuance Audio, these are glasses that are also hearing aids that are fantastic, that they have a microphone array in the entire frame of the glasses, and they listen in a space audio capacity way better than a hearing aid. I think there's a lot of things happening in audio that you don't know. I would just say, GPT or Perplexity, just tell me what's up in the world of audio. You're not going to believe it.
Jonathan, what do you think the title of our episode should be?
I think the title of our episode could be Learning to Listen, or it could be The Sound of Health.
Learning to Listen or The Sound of Health. Jonathan Dimitriades, thank you so much for joining me on the Visible Voices podcast. Yeah.
Thank you so much.
Thank you. The Visible Voices podcast amplifies voices in the healthcare, equity, and innovation spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis, MD on social media, or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by hosts and guests are their own and do not reflect those of their employers or institutions. Guest appearances do not imply endorsement of any product, service, or organization. Information shared here is intended for general informational purposes only, reflects the time of recording, and should never substitute for clinical judgment or individualized medical advice. No physician-patient relationship is created by listening to or watching this podcast. Together, we're making healthcare more equitable, one visible voice at a time.